You are listening to the Horse Radio Network, part of the Equine Network family.
Hello and welcome to this episode of the Disease Du Jour podcast. I'm your host, Carly Sisson, and in this episode, I spoke with Dr. Andrew Van Apps about laminitis in horses, including risk factors, management strategies, ongoing research, and more. This episode of Disease Du Jour is brought to you by Bimeda. Dr. Van Apps graduated from the University of Queensland School of Veterinary Science in Australia. His PhD studies focus on the effects of therapeutic hypothermia on the development of laminitis. He then trained as a large animal internal medicine specialist at the University of Pennsylvania's New Bolton Center and returned there in 2017 as the Dean W. Richardson Endowed Chair of Equine Disease Research. Dr. Van App's research goal is to identify the key mechanisms that lead to different forms of laminitis in order to develop effective strategies for prevention and treatment. Thank you, Dr. Van Apps, for joining us.
Oh, you're welcome.
This is obviously an area in which you've done extensive research, and we're going to dive into all of that a little bit more in a minute. But before we start, I would love to know if there are any common misconceptions about laminitis that you encounter, since this can obviously be a pretty complicated condition.
Yeah, I think probably what we encounter most commonly is that people's conceptions of laminitis are a lot to do with the experiences they've had with laminitis in the past. And one of the problems with laminitis is that it can be very severe and life-threatening, or it can be very mild or even asymptomatic and very sort of chronic and simmering. And there are big differences in the prognosis as well as the management and the sort of expectations for recovery for those cases. And so I think it's important to understand that there's a big range of kind of severities, presentations, and outcomes with laminitis. It's not all one thing.
Right, and probably a range of causes as well.
Right, yeah. So most commonly it's occurs secondary to underlying problems with insulin regulation, and high insulin is a consequence of, similar to people with metabolic syndrome or prediabetes. In horses, high insulin is commonly a consequence of obesity and excessive carbohydrate intake, either in the form of pasture or hard feeds or hay. And there's definitely a genetic component to that as well as a management component to that.
Right.
That's the most common reason that horses and ponies get laminitis out in the world. But less commonly are what we call sepsis-related laminitis, which is horses that are sick, systemically sick for different reasons. So maybe they've got colitis or pneumonia or sometimes retained fetal membranes and metritis. So they have systemic inflammatory disease, and that is a common cause in a hospital environment like ours here. We have those cases develop as a complication of their primary disease in hospital, and those cases can be quite severe and acute in nature. And then less commonly than that are horses that have painful limb conditions in particular that cause them to put excessive load on their other limbs.
Right.
We call that supporting limb laminitis, and that is probably the least common cause, although the importance of that one lies in the fact that we don't really even attempt to repair some of these complicated fractures and other really painful problems because of the risk of supporting limb laminitis, which is quite high in those types of particularly complicated, painful cases.
Right. How do you approach risk assessment, especially in some of these endocrine-related cases? Because I know it's easy to flag the horse that's obese, but some horses that have endocrine issues maybe don't present that obviously.
Yeah, I think we've come a long way in this area in the last 10 years in particular. The importance of measuring insulin in particular, because all things point to that being the culprit in these cases. The insulin is directly acting on the tissue of the feed to cause the problem. And so measuring insulin in the blood is one way to get a good handle on the level of immediate risk. The problem a little bit with insulin is that it goes up and down with feed mostly and varies a lot across the course of the day and with stress and other things. And you can catch it when it's low, or you can catch it when it's artificially high sometimes. And so what we need to often do is we need to either do standardized dynamic tests. So we give some sugar and we see what the insulin response to that sugar is. We often do that in the form of Caro syrup, oral sugar test, which is a standardized test. The other thing we can do is look at the specific response to feed as well, and we can look at the horse's own feed. The other thing that we can do is we can look at other markers of metabolic health, and the two that we can measure in horses are leptin and adiponectin. Leptin and adiponectin are what we call adipokines. They're produced by fat, and leptin is the bad guy and adiponectin is the good guy. So you want to have a low leptin and a high adiponectin. Traditionally, we found leptin not to be a great indicator of metabolic health. It tends to be higher in fat horses and ponies, but it doesn't necessarily correlate with laminitis risk, and it doesn't necessarily correlate with insulin dysregulation very well. They did a bunch of work with adiponectin, which is the good adipokine, in the United Kingdom, looking at laminitis risk and its association with insulin dysregulation in ponies, and they followed them over years and found that low adiponectin was actually a strong predictor of laminitis risk in ponies. And so we started measuring adiponectin in our research lab here at New Bolton Center, and we've repeated that work, or we've started to repeat that work. We've done some testing in about 700 light breed horses, so full-sized horses. And we're finding the same thing that they found in ponies. There are strong associations between low adiponectin and the risk of even having pre-existing laminitis in light breed horses like warm bloods, quarter horses, Arabians. And even more interesting is that the ratio of leptin to adiponectin seems to be an even stronger predictor than adiponectin alone. So you want to have more adiponectin than leptin, because adiponectin is the good guy. And so you want that ratio of leptin to adiponectin to actually be less than 1. And we're finding that to be particularly useful in the identification of risk and then also the management of these cases to minimize their laminitis risk and improve their metabolic health in the long term. So that's where we're at the moment with metabolic syndrome and insulin dysregulation. The other thing I should mention is that things that can tip these horses over the edge, increasing age and the development of other disease, and the big one is Cushing's disease or PPID. That's the one that we also want to be very careful to monitor for and diagnose early so that it doesn't, because in some of these cases it actually worsens their insulin regulation quite quickly and can tip them over the edge.
Yeah, I was going to ask you how you're selecting horses to test. Should this be sort of baseline testing for all horses, or is it sort of more for your older or metabolically questionable horses?
Yeah, there are some different guidelines, and traditionally we sort of had stuck to only testing horses that are even over 15 years of age for PPID, but I think it's probably more reasonable to test horses that are over 10 years of age, and we certainly recommend screening horses and ponies that are over 10 years of age, either with baseline testing in the fall, which is time where they naturally can have exacerbated hormone production that you can test for, or using what we call a TRH stimulation test, which is a bit more sensitive than a baseline test alone, but we generally do that outside of the 4 months. So we certainly recommend testing horses that are over the age of 10 and or animals even that could be slightly younger than that, but that have clinical suspicion of PPID. It's important not to test younger horses excessively because you're likely to increase your chances of having false positive results, which may not seem like an awful thing, but I think often it damns them to having the medication given for that problem for the rest of their lives, and it's not necessarily a good thing to do.
Right. Today's episode of the Disease Du Jour podcast is brought to you by Bimeda Equine. Bimeda might be the biggest animal health company you've never heard of until now. Bimeda's products have been trusted by veterinarians and owners since the 1960s when their Irish roots began. Bimeda is one of the largest producers of dewormers like Equimax, Bimectin, and Exodus. World-renowned equine athletes also rely on polyglycan, a patented formula that replaces lost or damaged synovial fluid, and Confidence EQ pheromone gel, which reduces and prevents equine stress. Consult your vet and visit bimedaus.com to see where to buy. So once you've flagged a horse as a higher risk for laminitis, are there any proactive measures that you can take?
So if they're high risk based on their underlying endocrine disease, then our first step, proactive step, is to change their management to try to reduce that risk, and that's going to depend a lot on the individual animal. So some of them need to lose body weight, they need to lose fat, and that can be done with a combination of diet and exercise. Some of them don't need to lose as much fat, but perhaps just need tight dietary control because they have a predilection or a propensity to just make a lot of insulin in response to feeds. And sometimes it's a matter of adjusting their feeds and adjusting their pasture access so they're not getting in situations where they make too much insulin. I think looking at the sort of insulin results and these adipokine, adiponectin, leptin type results can help tailor the approach to individual cases much more carefully. And one thing that's worth mentioning that we notice a lot just in our dealings with horses and with the endocrine results from the lab is that warm bloods and other large breed horses can carry a lot of internal visceral fat and not appear outwardly obese. And I think we noticed that some of these warm bloods and other large sort of light breed horses can have even ribs that are showing, but still have a lot of internal fat, and that is something that shows up in the leptin and adiponectin results that's quite useful for guiding further therapy, because I think it's common for people to be very reluctant to diet horses further or exercise them when they can see a rib. And I think in a lot of those cases, they're lacking some of the healthy fat that makes adiponectin, which tends to be subcutaneous. But they've got a lot of the bad fat that's visceral that they need to get rid of. And with exercise and diet, you can improve the balance in these cases. But I think it's important to use laboratory measures to get there, because otherwise I think it can be really deceiving how much internal visceral fat in particular they can be carrying.
Right, that's a good point. That's probably especially important if you're considering steroid injections for some of these warm bloods, because I know that can be an issue sometimes where that would provoke a laminitic episode.
Yeah, and that's a hot topic at the moment. How do you predict the insulin response to steroids, and how do you predict which ones are going to have a problem? Because we know that corticosteroids, whether you give them systemically or whether you put them in a joint, they exacerbate the dysregulation of insulin. They increase the blood glucose because they interfere with the normal metabolism of glucose. They increase the blood glucose in the pancreas response by making more insulin And there's no doubt that these steroid drugs increase insulin. And so if you have an animal that's already insulin dysregulated and has a high insulin, it's something that you need to be very careful with. But there are even some animals that are not, or that don't appear to be of the type that's likely to be insulin dysregulated. And maybe they're not even insulin dysregulated on testing, but they could still make high insulin in response to steroids. And getting to the bottom of how we predict that is the subject of some research that we're involved in and some other groups as well. And I think that's going to help prevent some of these cases that are associated with that, because it is a problem. And so I think a lot of people are doing some insulin testing and some endocrine testing, which is a great idea. And I do think that the adipokines, particularly adiponectin, is useful as a predictor in light breed horses.
Yeah. So what are some early indicators of laminitis that veterinarians should be watching out for in the field?
So I think the earliest clinical sign that we see, well, firstly, it's important to mention that they may have no clinical signs. And so for horses and ponies that have insulin dysregulation or are of a breed that has a predilection towards that and or laminitis, it's important to screen them. And there have been some studies showing that large percentages of horses that present, I think it was 70% of horses that presented to a hospital for workup of endocrine disease had underlying laminitis, and only half of those had any clinical suspicion of that or any history of it. And so we see the same thing with our work that we're doing in light breed horses in the field, that a good percentage of them have laminitic change on x-ray, but they don't necessarily, or they've had no clinical suspicion of it in the past. And sometimes they have no outward evidence of it on their feet or otherwise. So I do feel like it is important in animals, particularly that have diagnosed insulin dysregulation, to screen them with radiographs as well to see where their feet are at, because by the time they're lame, it's often the damage, is already done to an extent.
Right.
You don't really want to wait that long to see it. And some of them that are in active work, riders might notice loss of performance, reluctance to work, even before they notice overt lameness as well. So I think laminitis is underestimated as a cause of poor performance and a cause of reluctance to work under saddle. And then when you talk about sort of outward clinical signs, the sort of classic sign that you might see looking at the feet is hoof rings that are a bit closer together at the toe area, the dorsal part of the foot, the front of the foot, and a little bit further apart at the heel, and we call those divergent hoof rings. And those are something that should trigger practitioners at least to think about taking some radiographs, some x-rays of the feet to see what's going on. And then from a clinical perspective, classically increased heat, persistent heat in the feet, increased digital pulse, amplitudes of bounding pulses, and classically kind of stilted gait that might look okay on soft ground, but when they walk onto hard ground, often is much more obvious. And those are the early signs, and perhaps laying down more than usual is another.
What are some management strategies that you emphasize in the early stages of disease? I know that your PhD focused on cryotherapy, so I'd love to hear a little bit more about how that can be applied in the field, as well as any other recommendations that you have for helping horses through these early stages.
Well, I think firstly, it's important that these animals are confined initially, because once the damage is done, or there's enough damage in there to cause lameness, the tissue is weak, and we really want to minimize the number of steps that they take and make sure they're not trotting or jumping or cantering. And so particularly if you're going to give some analgesia, which we often do, we give some phenylbutazone or other non-steroidal, which are very effective for initial pain relief. It's important to recognize that that is not improving the situation in the foot, it's just masking the pain. And then if the animal is then not confined and is able to trot around, they will, and they'll not do more damage. So I think confinement is the most important thing initially. And then some sort of, depending on the severity, sometimes some mechanical support of some kind. So often we use frog and sole support. There are some people who will advocate for jacking up the heels or elevating the heels. And I think that makes some sense. The idea is to reduce the flexor tendon pull, but I think we don't really have evidence to suggest that that's necessarily better than just providing sole and frog support. And then we try to ease the breakover. So sometimes we do that we'll use silicone and pressure material for frog and sole support, and we'll build a bit of sort of a rolled or rocked breakover into that. Or sometimes they'll be wearing a cuff shoe or a device that can do the same. Or you can do it with a surface. So sand is a really ideal surface for horses with laminitis because they can break over really easily in sand in all directions, and they can pivot really easily. So I think confinement and some of this mechanical support is really critical. And then identifying the underlying cause. So if it's suspected to be insulin related, or even if it's not, I think these days we probably just measure insulin because it's so much easier to do. And it's worth making sure it's not high, because if it is, we want to control that really quickly.
Right.
And we can do that by taking them away from the feed source. That's about 90% of it. So if it's pasture, we take them off the pasture and we confine them. And then, if it's grain or forage that we've given them, then we do the same thing. And then, depending on the severity, some of the moderate to severe ones, it's definitely worth cooling the feet in the initial stages. I don't think it's worth it for every case, particularly mild ones. But, I think cooling the feet is something that can help regardless of the cause. So we've shown that it experimentally can prevent the development of insulin-induced laminitis, and we've shown that it can prevent and also halt the progression of sepsis-related laminitis in experimental settings. But the caveat is that it is very difficult to apply constant cooling to the feet in a field environment. It's difficult. So I think it's probably the number one reason that it's worth referring a moderate to severe acute laminitic case to a hospital, because they can be effectively cooled. You really need to attend to them probably every 2 hours at maximum to do it effectively, and that's just fairly difficult to do in a home environment. But ice and water immersion is the most effective way to cool the feet, and that should be up to the level of the sort of, ideally, the mid-cannon or above.
Okay. And that's less effective for support limb laminitis then?
We don't really know, but the problem with the support limb laminitis is that it drags on the developmental phase for some weeks and sometimes months. And so the practicalities of cooling their feet for so long are just not really there. And once you see clinical signs with supporting limb laminitis, it's often to intervene in that way. So, I think the jury's out for that one, but that's something that I think we may be able to solve in other ways that relate to dynamically adjusting the load-bearing pressure in the affected feet and encouraging them to ambulate a little bit more. That's a very specific circumstance that is kind of different from other forms of acute laminitis.
Right. Once you have the horse through the early stages of disease, do you have any rehabilitation and management strategies to prevent recurrence and support recovery and help the horse transition back into work? I know that's not always possible, but
yeah. So, how do you decide when they're ready to be let out of the stall or put back into work? And that can be, that's something we struggle with a little bit, because it's not like a tendon injury where we can put the ultrasound on and show that it's healed in and it's time to go back. We're kind of guessing as to whether the lamellae healed enough to allow us to put pressure back on that. As a general rule, it's reasonable to confine a horse or pony to a stall for a week for every day that they're lame. So if they have an acute laminitic episode that lasts 4 days, then that's 4 weeks in a stall. And I think that in my experience, I don't know who originally came up with that, but I think it's quite reasonable. It tends to work out reasonably well. We are trying to come up with better ways to track the repair of the tissue. And one way we can do that these days is with PET scanning, positron emission tomography, which is now available for horses and ponies standing. And it's something it's expensive, it's hospital based, and it's not practical for most cases. But we have a project that's sponsored by the Grayson Jockey Club Research Foundation, where we up here at Penn, at New Bolton, and also down in Florida, Dr. Diane McFarlane, we've collaborated to look at the healing or changes in the PET findings over time in these acute insulin-mediated cases to try to get an idea of when the tissue's actually finished remodeling and finished healing, which you can see on a PET scan. It's a functional scan of the foot that enables you to actually get an idea about what the repair and inflammatory activity is like in the tissue. And that it is opening our eyes to what's going on in there, because it's not something we've traditionally been able to image with radiographs or venography or CT or even MRI to an extent where we can actually functionally tell what's going on in the foot. So I'd say on that, we have our sort of rules and guidelines at the moment, and a week of confinement for every day of lameness. And also we want to see the x-ray. If there's any displacement of the coffin bone on x-ray, we want to see that stabilize. But I think in the future, the PET scan in particular is going to teach us a lot more about when it's reasonable to subject those feet to load again, to let those horses out in the environment again and return them to work.
Yeah, that's a really interesting development, and it'll be great to see where that project goes in the future.
And you had asked me also about to prevent recurrence. That's all about, mostly we're talking about the insulin-mediated ones, the endocrine ones, and that's all about monitoring their underlying metabolic health, their insulin in response to their home environment feed, and also their adipokines, the leptin, adiponectin, and the balance of those two things. These days, we have better tools for insulin control at our disposal, and most of these cases that have acute insulin-induced laminitis, we're going to use drugs to control their insulin, and the SGLT2 inhibitors and other bexagliflozin and canagliflozin are very successful in helping to control insulin in the short term. But these drugs are, they're a band-aid for insulin, and what you really want to do is you want to improve the underlying metabolic health through management, through diet, through exercise, get these animals back on track, and then hopefully take them off those drugs as soon as you can. But it is great to have now some better tools for controlling insulin, in particular, pharmaceutical tools.
Yeah. I imagine you're going to be monitoring these horses with blood work pretty frequently for the rest of their lives after a laminitic episode. Would that be accurate?
In a lot of cases, I think that, these animals that have had problems with laminitis due to high insulin sort of get put into the high risk category. And I think those ones warrant at least twice a year monitoring at minimum, and some of them probably more. It just depends. But yeah, I think it's one of the things that is, the availability of some of these drugs that help control insulin has been great. I think equally the availability of rapid turnaround testing has really improved our ability to prevent laminitis and prevent hyperinsulinemia in these horses and ponies. And that's been the biggest development that I've seen in my time. I think it's a real game changer.
Yeah, definitely. Before we wrap up today, do you have anything else that you would like to add, or any research that you want to highlight that's coming down the pipeline? I know we already touched on the PET scan project, but anything else about your work or anything that you think practitioners should be aware of coming in the future?
Well, I think we'll hopefully publish some stuff soon on the adiponectin, leptin, and insulin dysregulation in light breed horses, and I think that's going to help us interpret and monitor or get a better handle on underlying metabolic health, particularly in large breed, light breed type horses. We are doing some of this in donkeys as well, interestingly, and we're learning more and more about donkeys, and we have a similar project running in donkeys. We are also heavily invested on the supporting laminitis side, and PET scanning is actually teaching us a lot about the three-dimensional nature of perfusion under load in horse feet, and is also hopefully leading to the development of some methods to stop low perfusion regionally in these feet that are experiencing increased load or not enough load cycling, so they're not walking around enough. And I think I'm hopeful that that is going to help us in the future to prevent that form of laminitis. The only other thing I'd like to add is that we, in the laminitis world, funded almost completely by donor funding and foundation funding. There really are a lot of government funds available for this. So, we are very thankful to donors and foundations, but this is something that relies a lot upon donations. So if anyone is interested in supporting it, I encourage them to do so.
Yeah. Well, great. Thank you so much again, Dr. Van Apps, for joining us and sharing all of your knowledge on laminitis.
That was a pleasure. Thanks, Carly.
I would like to say thank you again to Dr. Van Apps for joining us, and thank you to Bimeda for supporting this episode. And as always, thank you to our listeners for tuning in to Disease Du Jour. If you have any questions or suggestions for the podcast, please send me an email at csisson@equinenetwork.com.